Good day, everybody. Dr. Sean here with the Arthritis Movement. Topic of discussion for right now is identifying your personal triggers for pain. Very, very important to recognize what we are doing to ourselves and also what to expect based on what we've done that day. Self-assessment, self-awareness is very, very important in managing any health condition. Being aware of how we're feeling and doing something about it is really, really important. One of the problems that you're going to run into as an arthritis sufferer is you will develop a pain tolerance. You will develop an ability to put that pain away over here in order to finish a task. As that ability enhances, then that strength or that tolerance for pain will build up in a negative way. And then all of a sudden, when we finish our day sore, because we're used to being sore, we don't bother stretching, we don't bother icing, we don't bother maybe doing some of the things that are going to make us feel better, and then we wake up again the next day sore. And the pain cycle progresses and continues and builds. So if we don't identify the things that we know are going to cause some problems and actually start structurally doing something about it, then the cycle will just progress. The problem with it is as our pain tolerance goes up, then we'll actually push ourselves towards injury. And when we tolerate pain, and then all of a sudden, we've all experienced it where all of a sudden you make that one movement. It could be as simple as picking up your toothbrush where it lets go. And the body says, okay, enough is enough. Now I'm going to add a bunch of swelling. I'm going to really increase your pain in order to force and induce a rest so that there can be some recovery. So identifying the things that are loading the tissues, loading your joints, causing potential injury or aggravation to the joints will help you then recognize what I need to do about it to make sure that I don't progress this towards an injury or towards a really, really nasty flare-up. So a pain log is really, really important as far as identifying sort of where is my pain, what is it at. Lots of ways to measure pain and self-assess pain. There's the visual analog scale is 0 to 10. Personally, I like to keep it simpler. 0 is no pain. 1 is a little bit of pain that I don't really need to do anything about. 2 is I'm reaching for medication or an ice pack in order to manage the pain. It's affecting my ability to function. I can no longer do the things I want to do today because of the pain. And then 3 is I'm on the couch, I'm stuck, I cannot move. So that 0, 1, 2, or 3 scale is kind of an important measure. What we want to change is most people react and start doing something about their pain when it is at that level 3, when it's actually, oh shoot, I can't get up and go for a walk this morning. I can't do the groceries today. I can't split that firewood. I can't play with the grandchildren. Then they initiate the process of doing some stretching or some icing, or maybe they go and see their chiropractor or their massage therapist or their physiotherapist. If we change our set point to pain to actually start doing things about our pain when they are at level 1, or even better, proactively and preventively before we get to increased pain, then we'll actually start to see less days where the pain affects our ability to function. So changing that set point, changing that trigger for you to act on your discomfort is really, really important in creating reduced pain on a daily basis. Reduced pain leads to more function. More function leads to more health. More health leads to better quality of life, better longevity, and overall just more enjoyment. So changing that set point, changing that that point where we choose to take action to do something that is going to make us feel better is really, really key. Recognizing, for example, one of our clients recently talked about having a good day and going for a swim class and then also feeling enough energy to go for a walk. And then proactively did some stretching, grabbed an ice pack, knowing that she wanted to feel that good again tomorrow. So really, really important knowledge base there to say, I felt really good today. I actually did more than expected. I exceeded my expectations. What are the possible outcomes as far as tomorrow and what can I do about them? So pick up the ice pack, throw a mat down, do some stretching, be proactive, identify your triggers, start paying attention to what your body's telling you, and start trying to be 1 or 2 steps ahead of the game. Hope this helps. We'll talk soon.